Good afternoon, everyone. Gareth Presch, founder of the World Health Innovation Summit, and welcome to the Health Innovators Show, episode 5. I'm delighted to welcome Mel Berry here from Her Spirit. Let me just start off by just welcoming everyone, and if you have a question, please do pop it in the chat. Myself and Mel will do our best to answer that. Mel, very welcome to the Health Innovators Show. We're delighted to have you as a guest. Please tell us a short introduction.
Yeah, thanks for having me, Gareth. It's much appreciated. So my name is Mel Berry. I'm one of the co-founders of Her Spirit, and for many decades have worked in the sport and physical activity sector. And 6 years ago, with my co-founder, Holly Woodford, we decided that we were going to definitely put our money and energy where our mouth was and create Her Spirit. And it's about providing a sustainable health solution for all women and connecting them to enable them to be even more amazing than they normally are.
Fantastic. And this is exactly what we're trying to articulate to people out there. We are all aware of the challenges that the health system faces at the moment, particularly in the UK. But globally, there's a real shortage of staff. And what we're trying to do through the World Health Innovation Summit and through our partners is to empower people to manage their own health and well-being. I think Her Spirit is exactly the sort of initiative that we need to scale. And I'm delighted to welcome you to the Health Innovators Show. Let's get into a couple of questions because I really want to get into the personal journey and your inspiration. What inspired you to pursue a career in innovation, particularly in the health sector?
Yeah, thank you. And my background prior to where I've come to now is elite sport. And I loved it because as somebody that was a swimmer, I loved that environment that was working with amazing athletes. So working for brands such as Speedo and Adidas. But it wasn't until I went through more cause-related marketing, so the work that I did with Boots and Macmillan, that I truly understood that you and your knowledge can make a significant difference to so many. And when you're making a difference to people's lives, that is wow, that's an amazing thing. And that definitely found my why is, enabling people to be their best self. And in this case, women. And so, yeah, that's my business journey in a very short, succinct way.
Brilliant. And so could you share like a defining moment in that journey? Like what was it that kind of like said to you, well, I want to set up Her Spirit? Like was there anything definitive there?
100%. And I talked just earlier, there was the work that I did with Boots and their partnership with Macmillan. And it was a campaign called Miles for Macmillan. And it was about getting a workforce to cover 1 million miles, because that's how many people obviously diagnosed with cancer. And what did it mean and why was that change? Is back to you can make a real difference. You can raise a lot of money. So collectively through trips to Machu Picchu, Kilimanjaro, other events, we raised over £500,000. And for me, that was that ignition to say, as a marketeer, I can do good and I can raise a significant amount. And understanding how women's lives are changed through things like that. That was that. And underpinning all of that was meeting Holly and understanding, well, if I have that feeling, what can I do that enables scale? And she had the expertise and knowledge around innovation and tech. I had those, I guess, the marketing side. So I believe it was a marriage made in heaven to be able to make a real difference to women's lives.
Fantastic. And I think that leads very nicely into like innovation itself, Her Spirit. Like what specific problem are you trying to address? And how did you identify that need?
Yeah, wow. I mean, the problem that we're trying to solve is massive. And a few stats I know we talked about earlier today is, first of all, there's 1 million women less active than men. So that's one of the first, statistics. The second is 1 in 2 women over the age of 50, of which, I'm proud to be in that 50 club, will break a bone due to osteoporosis. And if you look at the generation that's coming, that if you get to 16, 2/3 of girls drop out of physical activity. So the future is, again, a myriad of health conditions. So that's ultimately the problem and the problems that we're trying to solve. And it's not going to get any better. in the next couple of decades. So I would say those statistics are only going to grow rather than unfortunately decreasing.
Yeah. So how does the current approach is not working?
Yeah.
How do you improve that? That's sort of from your innovations perspective.
Yeah, totally. So our original hypothesis was if you can blend digital and physical together, do you create long-term sustainable health? So we do the digital, and we've done that for the last 3 years through an app. That app does a multitude of things. It connects women, so you can understand, people local to you, and that's the knock-on effect to them being able to connect in person. So that's that digital and physical. It educates women to then be able to understand what good looks like. And I think that clarity of what good looked like. So 150 minutes of heart raising activity and 60 minutes of strength work is what you need to do week in, week out. We have the gamification, which our health hub has an algorithm, which means the more activity minutes you do, the higher your levels. What we're trying to create, Gareth, I guess, and its synopsis is it's crack cocaine for middle-aged women and health, because they can't get enough of it. They want to keep being active. And I think the important thing that we do, and we see this so often not in our sector, is we can capture it. So for us, we've had in the last 12 months, 17 million minutes worth of activity. So it's real-time activity, because data is a really important thing to make change, isn't it?
Yeah, absolutely. This is the third point. We've sort of 7 topical areas here, and we're on to the third one already, which is you just outlined the sort of impact and the outcomes. What's the sort of innovation? What is that impact having on communities and the health system? I'd love to hear that on the ground. And you just mentioned how you've been measuring that, and just a slight bit of elaboration there. I mean,
Sure.
I'm sure you have lots of examples. I've actually seen some of your posts, which are very inspiring. Really getting down to the impact and the outcomes.
Yeah, I mean, digital is an amazing enabler. So if you take our app, which is our digital solution, which is obviously, innovative and it gives scale, is what we know and understanding behavior change really well, things that are nudges. And whether or not you use, James Clear, Atomic Habits, or whatever it might be, is like challenges. So, for example, every week, so it's the Monday Mile yesterday, those nudges then prompt women to be able to do, obviously, that. If you look at innovation, education is really important, and coaching. So, yes, we have a live stream every day that there's yoga, Pilates, and strength that women can consume, because unfortunately we know from a women's behavior point of view, they lack confidence and they lack competence. So confidence is I'm not good enough, I'm too old, I'm too this. Competence is I don't know where to start. So if you can give women those tools that give them, greater confidence and understanding, it's that ability to then be able to reflect and go, right, this week I did this and I did that. And I think the importance of, innovation and tech is around, highs that are, I think your post, my post, you commented it was Breast Cancer Awareness Month. So we did a challenge with Breast Cancer Now and our partner SOGS, which is called Swim for Her, because 1 in 7 women are diagnosed with breast cancer. And for me, in the 6 days of our challenge, I swam 21 kilometers, which meant that I was swimming for 3 women's lives. And I swam with those 3 women because I can't comprehend what breast cancer will be like. And if we bring it back into, I guess, an overarching why is if we were an active nation, we would reduce the breast cancer diagnosis by up to 25%. That's how important lifestyle is. And secondly, if you look at secondary breast cancer, which Breast Cancer Awareness Month is around secondary, is you can reduce the chances of getting secondary by anything between 30 and 40%. If you contrast that with chemo, it's 5%. So we don't, that, and for us, campaigns are important to raise those conversations.
These are all valid points, and very important that people, are inspired to take up those sort of activities. I think this sometimes is missing. I really like the way you're putting this together. The next one is about the challenging and learning experiences that you've had. I mean, this is a real important for anyone aspiring to be an entrepreneur out there. What are some of the biggest challenges you've faced while developing the innovation, and how have you overcome them? What lessons do you have, and what can you share with aspiring innovators?
Yeah, challenges. And it was interesting. I looked at this question and, I started by going, well, we need more funding and we need this. And ultimately we do. And one of the things that we're challenging our system is gender parity for women across everything from a health point of view. And we're so far away from getting that. But I think the key point and the salient point in this and other parts of our conversation today is around the system. We fundamentally believe the system is broken and the system keeps doing what it's always done, and the results aren't getting better, they're getting worse. If I contrast that with our innovative solutions, so 74% of women that come into Her Spirit are more active because of it. And that for us is statistically a really important, conversation to raise, because broken system, not enough money going into it, not enough money going into the right places. But we as a solution are showing year on year success. So we have to think differently. So I think that the challenge that, I guess lies at my door is you have to be resilient. You have to be innovative. You have to think differently. And you have to think about, how can I solve the problem for the system that then means that it becomes one that's embraced, rather than one that unfortunately would get sidelined because, again, it's too hard. It's too hard to solve box.
Yeah, totally agree. I think, everyone recognizes that it isn't working. What we're currently doing is just unfortunately not working. You just have to take the statistics. We talk about the numbers, there's 7 million people waiting for elective surgery in the UK. There's, 2.5 million people out with ill health. It's like really confounding this information. It's out there. It's in the public domain. You have the Secretary of State saying that it's broken. The Prime Minister saying it's broken. And I think UK kind of leads that sort of global health sphere, because people recognize this system isn't working from that perspective. If we look at sustainability and future plans, because I think this is pretty much crucial. You mentioned about, the financial side of things. I think this is a very, very important piece. It's something that we're very much active in, is how do you bring investors to the table? And, how does your innovation align with sustainable development goals, good health and well-being? You've given us some insights. And what are your plans to scale your innovation, and where do you see the future over the next 5 years?
Yeah, I mean, the future, I hope the future is a beautiful place rather than a place that we continue to have these same conversations. And I think that we will unfortunately still have them. For us, how do we? So we, over the last 3 years, have worked on understanding our market, and we now are building our own. So we're building our own tech, because we know the customer journey that women go on. So that's about that flexibility piece, and that's really important. From a sustainability point of view, yes, because, we're looking down the lens of women's health. So if we could get those 1 million women that are, aren't active, so to bring that kind of gender parity, that is a significant difference on sustainability of the health service, sustainability of so much on there. And we have to own our customer journey. So our future plans are being more robust and innovative to change. But I think, the point is that, data is so powerful, and so many people don't have their own data. So one of the things that we will be building is a big data hub of women's activity that, again, we can share with partners. And anyone listening to this, please come and join us, because we want to build the biggest data hub for women's activity that we collaborate with. We understand how we can kind of make change. So our sustainability is one of passion and purpose for kind of real change, because we definitely need to, don't we?
Yeah, it brings me on nicely to the 6th point, around collaboration, partnerships. How important is it to have partnerships, in your innovations development? Are there any key collaborators you'd like to mention? What role do you think cross-sector collaboration plays in driving meaningful innovation? One of the things I seen when I first came up with the concept of World Health Innovation Summit was like, how do you bring patients, clinicians, managers, voluntary sector, education, and the business community together so that we can actually co-create solutions?
Yeah, I mean, I think I wrote 100%. I'm just looking at my notes and it's like 100%. Yes, 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 yes. It is so important. But I think one of the mindsets that we have to change is collaboration is a important thing. We always talk about, Simon Sinek, the infinite mindset. Until you're truly prepared to give something up, will you succeed? And for us, we always start our partnerships around, right, let's put at the heart the problem that we're trying to solve. Because if you go through that lens, prosperity will come, and prosperity will come through the needs that you do. I think from a collaborations point of view in partnerships, the collaborations of, the people in our system. So, a lot of our coaches, people that have supported us from a tech point of view, they believe in what we do, and you're one of those people. So, my thanks, to you to helping us to do that. Brands that we've worked with that want to look through a different lens, and had a recent conversation from an organization that is again looking at how do you bring brands together to solve this problem, because you talk about international, they look down the lens of the World Health Organization statistics, and that's, scary. We have a global health crisis. This isn't just a blip and a knock-on effect from COVID. So vital. Yeah, people like Zogs, Breast Cancer Now, all those people that have been and wanted to look differently rather than historical, I guess, quite simple kind of marketing. So yeah, partnerships, collaboration all the way, but we've got to think differently.
Absolutely, I totally agree. Brings us on to our final point, and I think we're doing extremely well here in the timeline as well. Advice for aspiring innovators. This is a must for anyone listening here. What advice would you have, or give someone starting in the field of health innovation? How can young innovators stay resilient and motivated during the ups and downs of this journey? This is a question on this question. What's your thoughts?
The big money question, and I'm privileged to do a lot of work with Nottingham University on their entrepreneurship, and I get asked that question. And for me, it's truly understanding what your why is. And again, I'm a massive fan of Simon Sinek, and if you haven't, listened or read his, truly understand what your why is. When I ask many that question, they go, why? Well, I want to cure the problems of the world, and I want to be able to do all those things. And I think the importance is, I truly understand my why. It's about making a difference in for every woman. So take that time to understand. Make sure that you have good people around you, because the world that you travel and the road that you travel isn't one of pleasantry and excitement and enjoyment. It's that classic curve, isn't it? And, it's like this. And when you hit those highs, have people to celebrate with, because it's important to stop and celebrate. But then when you hit those lower times, resilience is a critical thing. And if you kind of want another person on extreme that I've been listening a lot to, David Goggins, you look at the resilience pieces, that's so vital. And get mentors. I've had the great opportunity to have fantastic kind of mentors that are people that, can pick up the phone and, you've been one of those, at times and say, Gareth, I'm really struggling with X. Can you think? Because I think we look through a lens that is one that you don't necessarily have the ability to look out from. So surround yourself with that, and don't take no for an answer is really the thing that, I would close on, because there's too many naysayers out there. We've done that for 20 years and it hasn't worked. We've done that for 20 years. So have confidence in self and get those people around you to give you that confidence that you can try, because, trying is a really important thing. And sometimes you may not succeed, but you learn so much through that journey.
Oh, fabulous, Mel. Look, it's been a real pleasure having you on the Innovators Show. We've just about under 20 minutes, so we're wrapping this up. I just want to say to everyone, thanks very much. Just one final word, Mel. Where can people find out a bit more about Her Spirit?
Yeah, just go to herspirit.co.uk or have a look at us on social at Her Spirit UK. Please come and join the community. You can come and join the community for free. And any organisations that, again, are thinking about looking differently or thinking that we can help on that health solution, please get in contact. We'd love to have this conversation, and let's make a better world for women's physical, emotional and nutritional health, because it would be a wonderful world that we all lived in. And thanks for the opportunity for this wonderful conversation.
Brilliant, Mel. Listen, just for everyone, that's www.hairspirit.co.uk. Is that correct?
Correct, yeah.
Brilliant. Okay, so for everyone else, this is episode 5. Our next episode is Mama Grip. It's focused on technology and to do with women's breast cancer. So I do hope you can join us. Mel, it's been a pleasure talking to you on the Health Innovators Show. And for everyone who's tuned in, thank you very much for joining us. And we look forward to talking to you again very soon. From myself and Mel, we'll say goodbye.
Thanks a lot.